Warm welcome to the Norwich High School Careers YouTube channel. Please could you introduce yourself?
So my name is Sam. I'm currently classed as a PCN Clinical Pharmacist. I work in Norfolk. So PCN just means Primary Care Network, and this is a kind of group of GP practices who work together. So my role covers more than one GP practice, and I work for that whole group or network.
So what does your job involve?
So this job is fairly new, really. Pharmacists have been moved into general practice to kind of support and promote safe prescribing, get involved with medication reviews. So, routinely, doctor prescribes something, they'll review it. That process is ongoing thing, make sure the monitoring's in place, the patient's getting on well, whether that's pain or whether that's a long-term condition. But actually, pharmacists spend 4 years learning about medication. So a lot of the time it's appropriate for a pharmacist to review the medication for someone, and we have a really nice team effort where the GP will send patients to me who need a medication review. In the olden times we'd go see them face to face, or they'd come and see me, but for now a lot of it's by telephone. So we'll do the medication reviews. We do a lot of work with care homes supporting safe use of medicines. A big part of my role now is looking at, do we overprescribe medication? Have we got people on 10, 15 medicines that actually could come off 4 or 5 and still be exactly the same? So a lot of that involves shared decision making, having a discussion with the patient. Do you feel that you really need to still take this? Try a week without if it's safe to do so. Because obviously I think patients forget that medications have side effects. And they may not be kind of short-term ones, they could be long-term things. So if we can kind of encourage them to think about, actually, I don't need that long-term, I could probably come off that for a bit. So promotion on that. Also at the moment, I'm involved in the COVID-19 vaccination campaign. So we're involved in, we can vaccinate. I'm a prescriber, so we're allowed to prescribe any kind of medicines, very similar to the GP or a nurse practitioner, which is probably what you're more familiar with. And as I kind of develop my skills further, I have the option to have my own clinics, whether that's managing things like diabetes, high blood pressure, heart failure. It's kind of dependent on what I would prefer and where I want to take that role. So, I said kind of main difference is your general practitioner has a fantastic knowledge of physiology, medicines, the whole thing. But where we really come into play is our specific knowledge of when you should use medicines, when they might not be appropriate, or if, not a lot of people are just on 2 medicines, some are on 15. And if we want to add something else in, the GPs might commonly say, oh, is it safe to do that? Can they have those things together? Or this lady's pregnant. Can I give her this medication? What would you recommend? So it's knowing where to look for that information, summarising it for the clinician, passing that on. But actually so much of my time is with patients. So we have a great amount of patient contact as well. So it's kind of quite a lot of things, but there's even more that we do. And, I've had different roles as well, but I'm sure we'll talk about them a bit later.
So how would you say the global pandemic has affected your role and your position?
So with most people in healthcare, the roles still are fairly similar, and the roles still need to exist. People still need access to their medication. They still need it reviewed. I guess the main thing is we're doing a lot less face-to-face reviews. So rather than a face-to-face medication review, it might be that you do it all by telephone as much as you can. The only person they see is if they really need to have blood tests. So some medications are classed as high risk, so we make sure they have regular blood tests for those. And there was a lot of guidance produced nationally that told us what medications we should keep calling people in for blood tests. Maybe rather than seeing them face-to-face to discuss those results, probably do that over telephone. If you think of your traditional pharmacist who works at Boots or Lloyd's, Tesco Pharmacy, anything like that, their job stayed exactly the same. And I sometimes, as well as my current job, we're quite lucky we can locum and do a bit of extra work elsewhere. So that's pretty much the same. It's just mainly PPE and reducing contact. I also work at the hospital as well, and that's been a very different situation. I admire the people who've been asked to do that full time, because it's a massive change in their role in terms of reduced patient contact and still trying to provide the best care that you can. And it's also looking at novel ways of doing your job. So we're using like things like this. So we're video calling patients and we're texting patients. And it's amazing how many 70, 80, 90-year-olds, are all, all up to date with it. They really enjoy it. They're getting involved, and it will change the future because it's made a lot of things easier. Do I really need to send someone a letter when I can text them? If they said, yeah, no problem, text me anything, then saves us a lot of time writing a letter as well, but also it's easier for them, isn't it? So
absolutely. I can certainly relate. My 85-year-old nan has an iPhone 8 and she's incredible on it, and she's constantly messaging, sending emojis. So I think definitely the pandemic has changed so many jobs, and I do think a lot of it will stay. Certainly from the education point of view, everything being done online, and that expectation of ICT skills, I can see it staying with us for a very long time. So what has been your career journey to get to this point?
So for those who might consider a career in pharmacy, basically you start out with your GCSEs and your A-levels. So usually they ask for chemistry, biology, plus one other of maths or, anything else you like. So I did chemistry, biology, and geography as my A-levels. Geography, it was a bit random, but for me, it was just a nice different kind of something that wasn't quite so mathsy or sciencey. I thought I need a break. I looked at some rocks for a while. So that was always good fun. And usually you have to have AAB or ABB to get in, depending on which university you pick. And then following that, you do a 4-year degree. So it's an integrated master's degree. So in your final year, you do a project. So that could be kind of anything from, so mine was a medicines management project where we investigated or researched a new study that was a new service that community pharmacists were providing. So I chose to do one that was more patient focused and did focus groups, but quite a lot of my friends did things on investigating new cancer drugs, looking at 3D printing, looking at tablet technology. So, they're trying to invent ways, can you invent drugs in a patch with microneedles? And these things might, come along at the moment, like patches that stick on. Well, we've got tiny needles on those. Can that become a way to deliver drugs? One of my friends had a project which was about kind of targeted chemotherapy based on heat. So obviously at the moment chemotherapy goes everywhere, but if you can make it kind of break down in heat and you heat up a local area, well then it might only just work there. So all these things are in the research phase, and in a pharmacy degree you kind of get to get involved with your really senior lecturers and professors. So that was really exciting. Once you've done your 4 years and passed all that, which obviously anyone who applied will do, and then you do your pre-registration year, which is kind of supervised practice really, and that's changing this year or next, so it'll be called a foundation year. And the idea is in that year you practice as a pharmacist, but with someone who is senior and supervises you for that whole year. And it gives you a chance to kind of get familiar with the role, get confident with patients, have a practice, whether you're in hospital, community pharmacy, or in GP practice. And then you do an exam at the end, and that final exam is set by the General Pharmaceutical Council. So like medicine, you have General Medical Council, nursing, the Nursing Midwifery Council, pharmacists have it as well, and you get a professional pin once you've passed that. So that's usually a 2-hour maths exam and a 2.5-hour clinical exam, and probably about a month later you get an email to say congratulations, you've passed. And then you get, hopefully anyway, and then when you get your PIN number, and then you can start practicing. So that's kind of where that goes. And after that you choose where you want to go really, whether you want to, most places have a supported program when you're newly qualified because they know it's hard and things are changing and developing. So I went to hospital, and I had a really lovely teaching hospital where there were lots of seniors who supported you, kind of taught you a lot of new things, and you didn't feel alone. You knew there was always someone there, and I think that was really nice. Community pharmacy, you're also supported, but for a short period of time, and then you are a bit more on your own because that's the structure of that. So it depends what kind of person you are, really. I prefer to have a little bit more support from others. I felt confident, but I wanted to know there was someone I could turn to. And GP practice is new even for practicing pharmacists. So I think in months or I'd like to say months, but probably years to come, we'll have more pre-regs in in general practice to learn about that role. And then you just keep going and learning. And like I did a prescribing qualification, you go do I'm doing another master's now. That's about clinical decision making and assessment skills. So you can choose. Or you might go with AstraZeneca and be part of the group who invent new COVID vaccines. It depends what you can do.
Wow, so many doors opening, which leads me nicely into my next question. So has your job enabled you to travel at all?
So me, I'm a bit boring. I'm a Norfolk boy, so I stayed here and then studied here and then work here. But once you've got a pharmacy registration, really, you could go work anywhere where it's accepted. So I know some colleagues of mine have moved to America. You have to do a conversion when you get there. That's mainly because Americans use pharmacists a lot more because of their private healthcare system. Australia, they will you can go over there and again do a short conversion course. Most countries require some form of conversion. There's not, I think there might be a couple, maybe like the British-owned overseas places where you can just go and practice. But most of the time, even for kind of saying similar with nursing and medicine, they want to ensure that you meet the standards of their council and go from there. But as a professional in most jobs, really, you're lucky. Your skills are valued everywhere, and even at the hospital, I know one of the pharmacists there went and supported some third world countries with their hospitals and medicines management as part of a response there to a previous epidemic, really. So there's certainly the chance to do that if you want to.
Yeah, so many amazing opportunities. Thank you so much. So if you were to interview an apprentice, what skills and qualities would you be looking for?
So I personally feel if you want to be a good pharmacist, you really need to have great patient-centered skills or communication skills. You just need to give patients the time to say what their concerns are, how they're feeling. And the main thing is you need to be approachable to them. Because actually when you have your consultation, you learn a fair bit about them, but it's when they call you back or text you back now or email you back and you find out that's what they wanted to ask, really. And if you can create that environment, that's great. You need to be a very methodical and logical thinker. There's a lot to think about. Drugs, there are so many. Which one do you pick? Why do you pick it? Does it interact with this? When can't I use it? Why should I use it? And that's kind of, as well as telling yourself, the main skill is you don't need to know it all. You need to know where to look for that information. Yes. If you go into an exam going, I need to know every single page of this book, it's never going to happen because it's impossible. So learn where you need to look for it and how to access the information and learn how to summarize it. Because again, coming back to communication skills, all day, every day, I work with nurses, doctors, occupational therapists, physios, and you need to be able to get on with them professionally. And then all together, you can really create some good outcomes. So, if those kind of skills are what you're looking for, and also being able to apply knowledge. If you've got the theory, you need to think, here's a clinical situation. I know that, but actually this patient has dementia and doesn't take tablets in the morning. So if that says that has to be taken at night, is there a reason, or is that just historical? So thinking about the whole picture, that'd be my main things.
That's fantastic advice. What would you say you enjoy the most about your job?
For me, it's definitely the element of teamwork and patience. So I really, really enjoy being with people, working with people, and it's nice when you feel you make a difference. So whether you talk to a patient and they've read something in the paper or heard something from a friend, or I've stopped taking that medication, not taking that anymore, but they didn't know why they were taking it in the first place or what difference it makes. So sometimes just giving them the 5 minutes to explain about that medication or that single tablet, they'll go, oh, I didn't realise that, and there might be a reason for that side effect, or this drug keeps me awake all night, well, take it in the morning. Oh, that's fairly simple. Easy things like that, but that's what's really nice when you do that. And the same with your colleagues. We're really lucky in my network. All of my colleagues are really, really welcoming. They help support and teach, and there's a lovely environment of everyone's approachable. And I'd say that's one of the most important things. If you feel comfortable with others and you can approach them, then the outcome for patients is great because you never feel afraid to ask a question. So it's great.
I can definitely relate to that. I'm very lucky to work with some amazing people at Norwich High School, incredibly supportive, and it really does make your job so much easier, and you enjoy going to work every single day. So I think that job satisfaction of being around people is something I can definitely relate to. So just finally, what advice would you give to your 15-year-old self?
So I think at 15, it's that phase where you start to discuss what A-levels are you going to do, what do you want to do for the rest of your life, and actually sit down and have a think about it. But for me, I think I kind of edged myself into I must do one of these careers that everyone says that I really think is, what you should do for life. But actually, a lot of the degrees that you do will give you skills of such a broad variety, and you learn so much at university anyway. You learn so much about yourself at university. So you might go there with a vision to do one thing, and you leave like, actually, I feel completely different about that subject matter. But it's thinking about the decision that you make now also determines the rest of your life. It's really important that you consider what A-levels you want to do, and in terms of university, you know what you want to go for, know what they're looking for, know what subjects, know what grades. So if you get there and you can't apply because you haven't done it, you either go back and redo it, or you feel a little bit like, oh, I've lost a year or so. But again, even if that happens, I think I feel that when you're young, you're told you need to get everything done so quickly. But, I'm only in my kind of mid-20s now, and I feel like, there's still ages to go. We work now until we're 60, 70 years old. So if you want to change your job at 40, you could do. But definitely start yourself out with mindset of get the exams under your belt, find out what you like. Don't be afraid to do stuff you enjoy just because someone says, that kind of A-level isn't what, like geography for me, or why are you doing that if you want to be a pharmacist? Well, I enjoy geography, and I know that all they want is chemistry. So that was my balance, and I still got it. And it's that kind of thing, enjoy yourself, have a good focus. I think that's definitely what I say. And life, and even though we're talking about careers, life's not always about education. It's about having hobbies as well. Enjoy your sports, or enjoy if you like reading or sewing, or I'm a bit old, I like planes, so I'll go and do really kind of geeky stuff with planes, but I enjoy that, and that means I've got time out. And that's so important. If you have a stressful job in the future, you need to go home and know you've got something to do that'll take your mind off it, and ways to de-stress, and talk to your friends about it as well. Don't be in competition with one another, help each other. You can both get an A in an exam. Don't hide the answers. That's kind of what I always found at school sometimes. And people would say, I'm not telling you. Well, we're all in this together, so support one another.
That is just wonderful. That's such great advice. Thank you so much for that. And thank you so much for your time this evening. It's been lovely to speak to you.
No problem at all. Good luck, everyone. And if you don't know about pharmacy, definitely think about it. If you like people, you like science, you like medicines, it's definitely something to consider. And a lot of the unis have got videos online explaining it a bit more and stuff.